On August 31st, our university will open for the traditional start of the academic year, and some of us will be returning sooner to move into residence halls or head back to work. This annual ritual is especially significant this year, as many of us have been away from campus due to COVID-19. Planning for the return of faculty, staff, and students has never been more important or more carefully considered.
Our biggest priority is the health and safety of the UB community. And so the university has developed new guidelines for everyone to follow. They are for everyone because each of us has a personal responsibility to protect ourselves and each other.
The first guideline is for those of us who haven't been back to campus for a while. UB is recommending a 7-day quarantine before the date you return to campus to start the fall semester. This is considered a precaution to help ensure we all return to UB symptom-free.
As health experts, we've seen clear scientific evidence that face coverings prevent the spread of COVID-19. Wearing a face covering is the most important thing you could do to protect yourself and others. So UB now requires faculty, staff, and students to wear a mask at all times, inside our buildings and facilities, laboratories like this one, and even outdoors. There are just a few exceptions where you don't need to wear a mask. These include students in their own residence hall room, alone or with a roommate, and if you're by yourself in an enclosed private office or other enclosed space, you also don't need one traveling alone in your personal vehicle.
We also know the importance of physical distancing, so UB is rearranging our classrooms and public spaces where people gather to ensure social distancing of at least 6 feet or more. We're also adjusting the course schedule, so there's less density of students in classrooms and less congestion in hallways, walkways, and buildings.
This will still be a vibrant campus with lots of people, but the most recent guidance from the Centers for Disease Control and Prevention tell us that testing everyone every day is not practical or effective. So UB will conduct daily mandatory health screenings. Faculty, staff, students, and visitors will be asked about any COVID-19 symptoms or any contact with people who have the virus, and in some cases, testing will then be required.
One of the simplest ways to stop the spread is hand washing. The university will encourage hand hygiene with stations all over campus, including sinks with soap and water, and hand sanitizing stations near many restrooms, drinking fountains, and building entrances. And all of our facilities, buses, and high traffic areas will be regularly cleaned and disinfected according to the latest health standards.
These UB guidelines are based on the expertise of faculty across the university and the scientific knowledge we have today. Things might change as we learn more, but it's always going to be a group effort and a shared commitment to stay healthy and safe.